do for you?
I came here for rhinoplasty.
Okay.
And functional issues also.
What is the functional issue? Okay, you've already taken a scan?
Yes.
She also tablets.
Sure. Correct. So you basically want me to do the septum and also the nose, both?
Yes.
Okay, and the nose, what do you want me to do? You have an idea already, some photo, anything is there?
I think she has already forwarded that to you.
Yeah, but now on the consultation you should tell. Because then only, or show or something, so I make notes on it.
Yes. There is small harm.
Correct.
So, and the dorsum base is there.
Okay.
And the tip of the nose.
Okay. You think there's a little bend to the nose?
Yeah.
Okay. So all these three things. Anything else you want me to do here where the nose is starting? Because there's a little bit of a depression there. You want me to raise it also, that area?
How will
It looks, you show me the noses that you like, then I'll tell you. That will look good for you, but I'll just... ரொம்ப வருஷம் தான் இருந்தாங்க நினைக்கிறீங்க இல்லையா? 3 years. யார் டென்டிஸ்ட்? சாராவா? பட் அவங்க 1 year தான் இருக்காங்க நம்மகிட்ட இங்கே. ஓ ஓகே. உங்களுக்கு உங்கள் ஃப்ரெண்ட்ஸா? ஹைதராபாத். ஓகே.
இப்போ ரீசெண்டாக அவன் கால் பண்ணி சொன்னான். நான் அப்போ இவர்கிட்ட கேட்டேன், இவர் சொன்னால் இங்கே சஜஸ்ட் பண்ணுங்க அப்படின்ட்டு. அப்புறம் யூடியூப் வீடியோஸ் எல்லாம் போய் பார்த்துட்டு இப்போ ரீசெண்டாக ஒரு 2 weeks முன்னாடி கூப்பிட்டு சொன்னாங்க, சரி நாங்கள் வரோம் அப்படின்ட்டு.
You found any?
No, I want to small sharp nose.
Okay, that is done. So you already said we want to narrow this.
Yes.
You want to make it straight, and you want to get a tip like that. This is done.
Yes.
My point is here, it's a little bit flat. If you can increase this height, no, it'll look nicer. If you want 3-4 millimeters, not a lot, a little bit. You want me to show you how that will look?
Yeah.
You have any photos that you want me to show you or anything?
No.
No. Then come. So all those things I've made a point, which we already discussed. Come.
And what about this angle?
Not much work is needed for you, because we can reduce it a little bit, but not a lot. It's pretty nice already the way it is. Your tip is also not bad. It's actually quite nice. Only thing you will lift it, because a little bit droopy. So what I'm saying is, if you lift it, see the length of the nose becomes less.
Okay.
So you increase it here.
Oh.
That's what I said. So increase it little bit, because here is too depressed. So you can increase it layer little bit. This width will reducing it.
But not much. Okay, just little bit here.
So let's say this goes up here by 3, or see this goes up by this, like this it will go. That's how many? 3 millimeters?
Yeah.
That same thing there.
Okay.
So that will be...
It will look good, right, here?
Yeah, it'll look better. Because see, when you do this, look in the mirror. You look at this area, this soft tissue, see how it gets tightened. So the eyes will... So the 100%. So the eyes will look more fresh when I do this. Little bit. You can see the grooves there now. Can you see? Even if we do 3 mm, it will make a difference. So that we can do.
Reharvesting is needed for this.
Most likely we'll need rib harvest, because you have a septal work. So when you do septal work, when I'm doing septal reconstruction, I'll need some other rib to bolster it, to support it. Imagine it's S-shaped already. Scan says I'll take another scan. It's going to be similar there. So when I remove that bent part of the rib, then I'll have to give it structure, a support to the structure. So that's when I need to put the rib to give more support there. It's just going to be a small incision. It's not going to be a big problem. That's really not going to be an issue. Even if I have to do on the side, it will be 1 millimeter or very minimal, or not required for a It's already quite narrow. Don't need to do much there. Tip will go up a little bit.
If you look at it,
Yeah.
on the left hand side, the corner of the lip is drooling. It looks like it's drooling. Right?
Little bit difference is there, but we are not going to do anything to that. We're only going to be working on the nose now.
Part.
That don't bother, because see, this is all muscles. So 8 muscles are joining and forming the modulus. No need to do that. I mean, just see this, it will be enough improvement for you. I don't recommend you to do anything on the lips.
Only nose is enough.
Jaw.
No need. What do you want to do with the jaw? No, we just... Even nose is not like a major thing for her. It's not like we're going to do a lot of augmentation or anything. It's going to be a few millimeters only. Because, see, little bit of elevation, little bit of narrowing, everything will be 2 to 3 millimeters for you. So 3 millimeters here, 1 or 2 millimeters here, this goes up by 3 millimeters, augmentation by 3 millimeters. So it's all like, you understand, we're not going to look at a new nose or something, just an improved version. Slightly a nose that's more suiting your face. So I'm going to stick with all of this then, as we said.
What's the procedure of harvesting?
So we make a small incision here on the right side. So in your case, all women, there will be no scar because the incision is put just under the breast. No scar will be visible. And then a small piece will be harvested, maybe 1 inch or 2.5 centimeters thereabout. And that will be used for various grafts on the nose. Mainly on the septum, because you need work on the septum. And also a little bit support, little bit here, something there. Wherever we need, we'll use it. It's like a material that we can use.
Without that we can't do anything.
It's not that we can't do, of course we can do. But with that, we'll be able to deliver you better results, get you much better results. It's not that we can't do. Yesterday's 2 noses I did, both I didn't take the rib. But you know, when you're having a severe problem with the septum, plus we have to augment the nose, then we need material. Artificial materials are not so good. So then this is the best option. It's not a concern, you're not going to have pain.
Is there in between, right? So
Septum is inside, you can't see. It ends here. But see, her support is not so good, there's a little bit bending. It's because of that little bit of weak septum.
okay.
And that's already shown in the scan. So when I see, just imagine it's a structure of a building. So nose is like a building. It has bone at the base. About the bone you have cartilage. Finally on the cartilage you have some cartilages coming like this, and then skin, soft tissues. So the bone thing only is a problem for you. The main cartilage is a problem. So we need to, you know, it's better to replace that with a better one, so your foundation for the septum is good. That report very clearly says actually what you showed me on the septum. Otherwise I will take the scan and then tell you. No, but the scan you will have to take it anyways on my system. So I'll be able to measure everything and all of that. Before surgery you'll have to take 1 year. It's better.
Last year only I took pictures.
Yeah, last year. This scan report is already written clearly, right? I can show you the bend also if you want, but they very clearly documented the DNS. It's all here. If you have any insurance, this part you can claim. I can give you a letter. Possible.
They have insurance.
So you can do that. You have one more scan report also. I'll also give you another one, so you can claim your insurance only for that. That's possible.
So which part of the procedure will cover under insurance?
Septoplasty, not rhinoplasty. Rhinoplasty is a cosmetic surgery. So what we will do is, because you have a functional problem, you have a bony problem, you have a septal problem, So we will highlight that and give you the report. So you can use that for your insurance. So, but generally they will give some percentage,
Yeah.
70%, whatever it is. But still, it's a good thing for you to cover. All right. Any other doubts, Veda?
How much time it will recover for rib harvesting and nose?
Rib harvesting is not going to take more time. Nose will take more time. About 1 week, at least 8 days, 7 days of stay here. Total healing will be 2 to 3 weeks.
Okay. So total 3 weeks.
Total healing you can put 2 to 3 weeks. 1 or 2 weeks extra only, not less. When do you want to get it done? Think
Tomorrow.
about that. Yeah, tomorrow. Time has? Huh? Okay, maybe tomorrow afternoon or something we can plan. So what you do, you can just leave now because I've done the consultation, you have the scan. Come tomorrow morning after having breakfast at 7 o'clock. Come here by 10 o'clock. Breakfast at 7, come at 10. We'll start surgery by 1 or 2. So when you come here, we will do your blood test, and so today you're free to just go around and see some places or whatever you want to do. Right? इनका CBCT भी कल निकाल लेना और ब्लड टेस्ट भी कल कराओ, ECG भी कल कराओ, सब कुछ कल कराओ और कल अपॉइंटमेंट दे देना. So you come in the morning by 10 a.m. after you have your breakfast at 7, not later than
What
that.
about the insurance? You need to get the clearance.
So we don't have cashless. We don't have cashless insurance at all here. We don't have any insurance. So we will give you a letter and the receipt, discharge summary that you have to apply, and they will give you reimbursement. You can write a letter if you want an email to your insurance saying you're undergoing something tomorrow. With that, that's it. They'll have to give. There is a problem inside. So if you're doing something else along with that, that's not their concern. You're basically doing that. So that's fine. They'll give.
If they ask for any...
We will give you. Everything we'll give you. When you leave from here, we will give you everything.
Okay.
So what is the diagnosis, blah blah, what is everything.
No, even before the surgery, if they ask...
Before surgery, we can't give you much, right? What will we give you? We can say you're scheduling for this surgery. What can we do before surgery?
We can mention the problem.
They will give you. It's not, I know because so many patients we keep doing this. 99% nobody has insurance problem with this. Hello? Okay.
Hi everyone, here we have a young female over here. She has come for rhinoplasty procedure. So speaking about her concerns, you can look at her nose. Her nose, from the top you can see her radix is depressed, and she has a wide dorsum, and she has alar flaring too. So she wants her radix to be augmented, her dorsum to be narrowed, also her alar flaring to be reduced. And one more concern she has is her tip. Her tip angle, she is not happy with her tip this angle, so she wants this tip to be raised a little bit. So overall she needs a cosmetic rhinoplasty. She doesn't have any functional issues as such. You have breathing issue, you have?
But DNS is
Yeah, when we have taken her scans, it was diagnosed her DNS, deviated nasal septum, is present. So it's going to be functional and cosmetic rhinoplasty for her with the possibility of rib harvest. You want to speak something? Fine. Okay, thank you.
Cosmetic nose job. There's also a functional rhinoplasty because patient has breathing issues. Patient has a severe DNS that we're going to correct. So since there's a lot of septal work and septal reconstruction, we've also planned rib harvest. Treated with this cosmetic and functional nose job. we're going to show you the different views. We've made the nose really so we're going to show you the before too. You can see the difference. So it's become way narrower, slimmer, and the tip sharper, more projected. Alright, side view. This was before. Case we have how many cases as of now? 1 is it?
அது பைஜா நல்லா இருக்கு.
Other ones are 24,000. So what all you wanted me to improve? Can you tell me? I'm trying to distract you from the pain. Maybe just clear a bit. Okay. You may see. Right, show that. So one thing is, because we've put the compression here, right, it looks extra compressed, it will relax. And here, because it's there, there'll be some swelling on other sides of the splint. So that will go down, and if you see here, so the tip is nice and projected. It's going to all, fall into place. This is all swelling. So once it goes, you get a nice dorsal line. How's your breathing? Pretty good. The slight blocks are there because lots of sutures are there inside. Once that sutures come off, then it'll be really nice. Okay, you can look that side. That side. So you can see here. Then we can go back to this side. Okay. Yeah. What do you say?
This part is definitely
Good.
It's good. But then it got elongated is what I...
You feel it's become too elongated? Too long, you think?
Too long.
No, it'll take some time, it'll settle down. Too pointy. See, look carefully. No, look in the mirror. So this is the upper third, middle third, lower third. If you look at your face earlier, the nose was not at all prominent. It was very small, very short, hardly supported. You look at your face, it's nice and angular. You're thin and slim. You're not fat and round, and so once this swelling goes off, of course it's going to be a much more, your face will have a very prominent nose, which will look good. It's not going to look bad, because earlier you see the nose was like hardly visible. So that's why the augmentation, the improvement is probably quite different now. But once it comes down in swelling, it's going to look good.
Swelling is good.
Yeah, so this area, look there, this area where we put the pressure, right? This is all compressed. So when it heals, it will be like that maybe. Here will go down, like this. Here also will go down, both in height and in proportion by about 2 millimeters. Not a lot, but you still have a well projected nose. Look at the sides. When you go to the side now, look at that. The earlier nose was like in all aspects not proportional. So now we've got, I think it's looking very nice. It's going to take some time to see all of this bruising to go down, the swelling to come down. And because a lot of bony work is done, the results are taking a little longer for you to really visualize. And right now I know you feel that there's a lot of change in your face. Obviously, there is a lot of change because you desired also a pointy nose. So, and see, if you look at your facial structure, it's all very slim face you have. So a slim nose, it's going to just suit very well. Well, your earlier nose was not slim, it was short and pretty stubby types. So when do you all leave?
Today.
Now. Then sutures got to be removed now. We'll take off the stitches. How much is your pain, the rib harvest area?
Yeah, it's there.
It's there. On a scale of 1 to 10, what do you think will be the number of pain?
6, 7.
Really? That's quite a lot. Okay. And the first day after surgery, what was it?
First 5 days it was okay.
Less pain after first 5. Now it's increased?
Yeah.
Okay. And since when?
From past 2 days.
Okay. So we'll have to look if there's any collection or something. Pain shouldn't increase after 5 days. We just check. Have they checked have they removed it? Okay. I'll have a look as well. Nothing to worry. It should go off. So when you move a lot, probably you're moving around more. So what happens, the muscles move when you move your hands, because that's where the rib is taken from beneath the pec. So that's when you can get some extra pain probably, but it's going to be fine. All these bruisings will disappear. So you have one under the eye, there's one here as well, some discoloration. Everything is going to get your normal facial color. So that's not an issue at all. Okay, so we'll have to after suture removal, photos also, and don't forget. Okay, I'll see you then and you take care. Bye bye.